You are recognized to offer an amendment.
Thank you, Madam Chair. I have an amendment at the desk.
The clerk will distribute the amendment. Ms. Bonamici?
I reserve a point of order.
Ms. Bonamici reserves a point of order. Mr. Smucker, you're recognized to discuss the amendment.
Thank you, Madam Chair. Now more than ever, we must prioritize the fight against drug and opioid abuse. The Centers for Disease Control and Prevention reports that in 2015, opioids were involved in the death of more than 33,000 Americans. That's more than double the rate of 15 years prior to that. It's a tragedy. The opioid epidemic is engulfing not only my district, my home state of Pennsylvania, but also each home state of the members of this committee. It's a nationwide epidemic that none of us can ignore, and it requires our action. This amendment would require the Secretary of Education to work with the Secretary of Health and Human Services and other outside experts to identify successful recovery programs on college campuses. It'll provide support and assistance to those programs and then share best practices with colleges and universities nationwide to increase the number and capacity of high-quality programs to help prevent and combat addiction, as well as to help students recover from addiction. While our higher education institutions have frameworks in place to help identify and treat students who have fallen victim, combating this devastating epidemic is not something that students can do on their own. My amendment will also help ensure that the Secretary provides further assistance to schools if they're struggling to implement a substance abuse prevention program for their students. So, Madam Chair, I urge every member of this committee to support the amendment so that we can help to stem the tide of addiction that has swept across this nation and in our schools.
Thank you, Mr. Smucker. Ms. Shea Porter, you're recognized.
Madam Chair, I move to strike the last word.
You're recognized for 5 minutes.
Thank you. I thank Mr. Smucker for his work and commitment in what we all know is a nationwide epidemic. The idea expressed in the gentleman's amendment to require the Secretary to identify successful college recovery programs, for example, is good. But I respectfully suggest that it by itself is insufficient. I plan on offering an amendment to ensure that institutions of higher education offer evidence-based drug and alcohol abuse prevention programs that include a specific plan to address opioid misuse. Drug and alcohol abuse prevention programs have been required by law for years. It's concerning that the underlying bill would drastically weaken this amendment. My amendment would preserve the requirement with a strengthened focus on the opioid epidemic, which is huge in my state as well. Would the gentleman consider withdrawing his amendment in support of the amendment I intend to offer, and we can work together to include the Secretary's recognition of successful programs as you propose in the committee report?
Thank you. The purpose of this amendment is to not only provide assistance to the schools, but to identify and share best practices. And just my own experience as a business owner for 25 years, some of the best ideas I had were when I learned what other businesses were doing through sort of forums and best practice groups. And so I think that the amendment is important for that reason, to be sort of a clearinghouse for what is working and what isn't. It was just a part of another hearing where we talked about the opioid epidemic and the fact that to really combat this, it takes many different individuals and groups and organizations, and there's no silver bullet. It takes new ideas, new ways to approach the problem. And so this is essentially identifying best practices. I also agree with, I think, the amendment that you'll be offering in terms of schools ensuring that the solutions they are implementing to address the problem are evidence-based and that they work. And so I would have no opposition to the amendment that you will be offering later, but I also believe that, that this amendment is important, and I look forward to continuing to work with you on combating this problem.
I thank you for that, and I hope that you will support my amendment as well, because while I certainly think that yours is good, I think we can strengthen it by actually making sure that the schools have to have these programs and that they are tied to funding, because we simply have to reach every student who is challenged with a drug or alcohol problem, and we have to work on the prevention part as well. So I hope that means that you will be supporting.
I will support. I'll just one additional comment. You know, this my amendment is intentionally not a mandate on schools, but it simply provides assistance, and so that was the intent of my amendment. But I do think that there should be a minimum standard in terms of what schools provide, which I believe goes to your amendment, and so I'm happy to support your amendment as well.